Now in his 70s, Professor Khama Odera Rogo is the sixth of 8 children, including the late Orie Rogo Manduli, his eldest sister. He was named after Chief Odera Ingem, a chief who encouraged education. Back then, the Anglican Church didn't allow African names, and children upon baptism were required to take up English names, for which his father was opposed to. Luckily, there were 2 African names allowed: Kwiga Agri, a missionary and teacher from Ghana, and Khama, the Botswana king who welcomed missionaries in Southern Africa. And as such, he was named after Khama.
You must know you are in game. You are in game. And game is one of the stronger clans in Lowland. Yeah. So Chief Odera, who is credited with encouraging education and everything here. So that name, Odera, is a chiefdom of that. So maybe he thought that I could rise. But, yeah.
Do you think you've lived up to those, actually 3 names, the Khama, Odera, and Rogo?
I believe to a large extent, yes. Yeah, without professionally. Yeah, not the political royalty, but professionally, I think that I'm there. I think I'm there.
Being a child of teachers meant that they grew up guided by 3 principles: work, learn, and pray. He schooled in Tomboya High School, Maseno School, and Duke of York, now Lerana School, for his A-levels before pursuing medicine at the University of Nairobi in what was Kenya's 6th medical school class.
What inspired you to do medicine?
Okay, I think that it has to start from where we were. We lived in Kaloleni. So I'm a Kaloleni boy. And Kaloleni, which is now called Kaloleni slums, the word slum didn't exist then. So it was just a place where African lived. And Kisumu was a perfect apartheid system. Africans were living in Kaloleni, Indians had their place, Wazungus were in Milimani, schools were separate, Arabs were in the Manyata Arab in the mosque area in Kisumu. They even went to their own schools. So we were not mixed. Manyata and Nyalenda and Kondele were not part of the city. Those ones were called African reserves. So ukimwambia mtu kwamba wewe unaishi kwa reserve, you reach in the reserves. Just like this game reserves, there's African reserves. Okay? So that is where we were born. And Kaloleni then was a mixture of everybody. Tribeless, faithless. It was a mixture of that. And that's where we were born, and we grew up in that. In that lawless setup, the thing that distinguished family was the strictness of the parents. Because you'd mix everywhere, play truant, not go to school, but strictly that. And my parents and other parents, we have a lot of very successful people who came out of Kaloleni, were known for that strictness. Mwalimu, follow the rules. Sunday school, go to Sunday school and that. So we grew up in that environment where you are mixed Africans speaking all languages, but you are third class. Indians are second class. Indians and Somalis were together. And then the Mzungu is up there.
First class.
So we grow in this environment in which even for you to live in Kisumu, the town itself, you needed a pass if you didn't dwell there. So people from Manyata and Nyalenda, to come to town, you needed a pass.
Wow.
To spend a night in even Kaloleni visiting a relative, police could come in the middle of the night, white inspector with the dogs, knocking the door to see how many people have slept in this house. And I still recall, because we used to sleep, many of us, on the floor on the mat, the white man knocking, and if they knock 3 times and it's not open, they kick the door open. And they come in to just count how many people are sleeping in there. So you as kids, you'll be there, you're waking up with these dogs that are sniffing, the Alsatians and so on. So that is what we grew up in.
So how would they know that there's an additional person? Did they have
It
like
was
a record?
random.
Did they have a record to know that
Yes,
this
because the
house...
people who are in there, they would have, yeah. So we start then going to school. Primary school, we are all walking there. No shoes at that time. And you start learning. And you start learning about the explorers, the David Livingstone. Yeah, that David Livingstone was particularly because it was Dr. David Livingstone. Yeah. Then you start being exposed then to the health services there where they were dressers, not even clinical officers, but they had white clothes, and you go there and you start admiring these people because they're so clean, they're white, and they can tell you anything. Open your mouth, and you open
And
your
you
mouth.
open.
Yes. So that is an interest that you start having. Then we start playing sports, and for some reason, I was always very good at sports. I played football all the way to Gor Mahia.
Oh.
Yeah, I was always a team doctor. For some reason, if somebody was injured, I was always the team doctor.
That
But
was even before you became a doctor.
no, this was primary school, yes. But something happened sometime when I was in high school. This area of game is famous for academia and doctors. And in fact, Magoa's home is just nearly here, there. You'll get, I'll watch down there. You can see who's who. Arambo is down there, yes. So there was one Dr. Ochieng, one of the older Makerere guys, who was one of the first African private practitioners in Kisumu. And my father sent me with a letter to him because my father was the chair of the game people in Kisumu. So when I went to knock on his door, and they opened, and I went in and received the letter, then he asked me, young man, you're in school? Yes. You're in what? And said, I've just entered Form 1. And said, what do you want to be? He said, I don't know. Then he said, yes, I can see in your eyes. Be a doctor like me. Okay? So people will not call you Mr. anymore. Be a doctor. You hear that? Yeah. And from that time, it just entered my head that I would want to be a doctor. And luckily, the passing of exams was not a problem. And there you are. And then we are in this school system at that time that it was really merit.
Yeah.
Yeah, that your exams, O levels, A levels, they're all marked in the UK. You wait to read the newspaper.
Oh.
Yeah, it was in the newspaper that you buy newspaper that day to see whether you had passed, which grade you had passed in, and so on. So there was nothing like your uncle or your brother who's influenced exam. Then you see you're in Division 1. Then A levels, you have 3 principals and a subsidiary. And then you just sit there and wait for a letter to come. That letter tells you, okay, you're now going to A levels in this place. Then university too, a letter just comes in the post office that you're in the University of Nairobi, medicine. And you park and you go. And you arrive there and you meet other people who have passed well, and that's it. So the impetus was seeing what was around me, the encouragement of Dr. Ochieng, and most important, I think I was bright. Because in high school, my English teacher, Mr. Taylor, in literature and English language, always thought I should be a lawyer. But later on, I came to realize that actually there's something that is tougher than being a lawyer. And it became medicine. Yeah. I think it would be a walk in the park if I went into law school. It was not challenging enough. Yeah.
So had you not met Dr. Ochieng, do you think you would have ventured into any other career?
Law, probably. Law was the other alternative. And in my O-level results, I had 1-1 in all those things, in English, in history, and that would have taken me easily in that. But then, at that time you choose, when you go to all A levels, you choose whether you're doing sciences or arts. So I chose biology, maths, and physics going into that, instead of taking English, history, and geography, which have taken me to the other side. Yeah.
So when you joined the University of Nairobi, 1973, did you find medicine to be as challenging as you say it was, or it was still a walk in the park for you?
Tough. It was tougher than I thought. One thing is that the 80 or 83 of us were the best students in science, not only in Kenya, but in East Africa, because we had an inkling of Tanzanians and Ugandans. Although we had separated from Makerere, still they took in students there. So you can imagine that if you are students, you are the best. You've all been number one throughout. And then you come into this place where you find you start looking for your name after a test has been done. And you're used to checking up there and you don't find it. And you find it's the middle or in the lower, yes.
And you're not used to that.
So all of a sudden you realize, you mean this is it. The second thing, brilliance, total brilliance, really, really bright kids. The second thing was, I was also a sports person. So when I went to university, I was still playing Premier League football for Kisumu Hot Stars. So on Fridays, I would be on the overnight bus to come to play on the weekend league at Kisumu Stadium. I arrive in the morning on Saturday, sleep. In the afternoon, we jog, and we are at Kisumu Stadium. I'm part of the team. Yeah, these guys, Bobby Ogola and so on, those are my teammates. Yeah. Then at the end of the match, you are celebrating, you sleep. The following day, you take a Kamba bus. It was a Kamba bus then, not Easy Coach. And 1 o'clock, 7 p.m. you are in Nairobi. And then on Monday you are in class. So your colleagues who are in Nairobi probably are enjoying but are also studying. You are a footballer. So mixing those two things became tough. And our professor of anatomy, Professor Mungai, in one of the class, he used to teach on the human structure and walking. He comes to class in the morning and he has a newspaper. So he sends a newspaper around to the students and say, look at the back page. Who do you see?
That's the sports page.
Yes. And we had just played Kenya Breweries in Kisumu. And the photo there was me in the air heading. And Winzi Mwakolo was a Kenyan star brewery. So my photo was there. So people look and said, hey, this is Khama. So he takes it, but you know why I'm showing you this, guys? Medicine is tough. You don't mix it with anything else. So tell your friend to choose between playing around with the ball and being a doctor. Apparently, Professor Mungai had been a sprinter and an athlete in Makerere. And because he mixed the two, he had to repeat several years. So his experience was that you don't mix sports and
And
medicine.
medicine.
You go to medicine, you dedicate it to medicine. So this thing made a lot of people, young people who went into medicine, who are sportsmen, stop doing sports. And I know some of them. The late Dr. Olema was a Kenya national team footballer. He was 3 years ahead of me. He went there, he had to stop football. It's only later, much, much later, that the mixing was allowed. And that is when
JJ.
William Obwaka, Dr. Bwaka, and Masiga,
JJ Masiga, yes.
JJ Masiga. So they came later when that one was allowed. So it was tough because the first year with anatomy was tough. You had to cram and cram and cram. There was no way out. So that was very, very tough. Embryology, extremely tough. How they say. And then, of course, you had biochemistry and so on. Yeah.
And
The first 2 years, I think, in medicine are the toughest. Yeah. So it was tough, but it was rewarding because it was challenging. You just had to discipline yourself and be there. Remember that we went into university at a time when they used to be given an allowance. Boom. And when people got that, guys got drunk and so on. You, as a medical student, you're in the main campus with everybody. All your colleagues are doing the others. They are enjoying. You got to create your time and make sure that you're up to that. So you could enjoy, but the moment you go to Chiromo classes, then you see how far you're behind. So that competition, the toughness of the amount of information that you have to learn, made it tough, but rewarding.
Okay. And upon graduating in 1978, where did you start your practice from?
Interesting thing that my years at the university were also very colorful because those are the students' activity. I was a student activist too. So I was chairman of AMSUN, the Medical Students Association, and I was also vice chairman of the African Medical Students. So when I dropped sports, I came strong in activism. So I became our class leader, and I'm still the leader of that class 50 years later.
Wow.
So when we celebrated our 50th year last year of class, that went in 73, I'm still the undisputed class leader. So it is not by election and it is not by rejection, but that's it. So that one also made it tough because I have some very interesting things on my interaction with the teachers, with the university system and so on. Because it was during our time when the ugly head of tribalism started coming into the faculty. And the removal of Professor Giambo from chairman of Department of Medicine happened then. And I was the student leader then. And we boycotted classes because we did not think that that was academic. Professor Giambo had given an inaugural lecture at Gandhi Hall on the title was The Pursuit of Excellence. If you know Josephine Ojiambo, the daughter, you ask her to give you the father's paper. Because that was a time when they started questioning the criteria for being a professor. And during his 25 years of experience in medicine, the pursuit of excellence, he questioned the criteria that was coming in then. It was no longer excellent publishing and research. It was ethnic. At the end of that lecture, which was professorial inaugural lecture, that night, the vice chancellor, Professor Karanja, who later on became the vice president, ordered that he be demoted from chair they removed his books from his office at night. And when we went for lectures in the morning, we found his books were in the corridor. He's no longer chairman. He has no office. They are in the corridor. And somebody else had been appointed. Asked why it was said that he said some unpalatable things about his colleagues. That there are some people who are becoming associate professors with one publication or two publications, which was true.
Which was true.
So some people called Karanja that afternoon in the golf course in Muthaiga. And Karanja ordered that the guy is to be dropped. Hilary Ojiambo. So we decided that we were boycotting classes because we said, no, there was nothing criminal that this guy said. We all enjoyed, everybody applauded. The dean was there and the whole faculty was there. So what is the problem? So I was summoned as the chair of AMSON to the faculty board meeting. Why were students boycotting? And I said that clearly. That is because I think that Professor Ojiambo has been treated badly and that all of us who are there find absolutely no fault in what it said. So unless you reinstate him, we are not going in for lectures. This was followed by 4 days of boycott with the board meeting every day, and I was the only student
In the meeting.
in the board meetings. I think I was in the final year then, and I had very, very rough time with my colleagues because the ones who were sent the complaints were also my professors, and I had to tell them that's this was not about you as an individual. It's about the character of our institution. And as students, we take this stand. 3 times I was sent away and told to go and tell my students, the students to go back to class, and I refused. So they threatened me with not being able to sit my final exam, and I said, no problem. But we stood by what we did. They never reinstated Ojiambo, but we never recognized the professor who was put there to chair that. So we then finished medical school.
So what then made, after the 4 days of boycott, what made you go back to class?
Because Ojiambo came and talked to us.
Okay.
And he told us, thank you very much, students. Your future is more important than mine. I have made it. Any university in the world wants me. So continue. What you're standing for is right, but you must also know that you have a future. That's when we went back.
Those are powerful words.
Yes, they were. So we finished medical school, and in those days when we finished medical school, KMA would have a party for you to welcome you to the fraternity. And you would go to Afya House. First of all, you go on the blackboard, on the board, school board, to see if you're passed. Then you go to Afya House. By the time you reach Afya House, you'll find they already have a list of your posting for internship. It was now, initially, internship was only done in Kenyatta Hospital because that's where you had all the consultancies. But they started moving it to the provincial hospitals. So they had started moving people to the provincial hospital. So you'll go there and you'll be told you're posted to Mombasa, Coast General, Kisumu, or Kakamega, or Machakos, or Nyeri.
Rift Valley.
Yes, and Nakuru. Yeah. So those ones were that. At that time, Eldoret was a small hospital, so there was nothing like Eldoret. It was Nakuru. So you go there, and you see there, and you're given a letter. And with that letter, you are also told to pick up your ticket. For Mombasa, it was a railway ticket. So all of us who are going to Mombasa, I think that there was 14 of us, the biggest number ever to go to Mombasa. We got our ticket, railway line, chukua gari, you go and you arrive in Mombasa. Then you make your way to the provincial hospital. You meet the hospital superintendent, Dr. Kulumba Mwangala, and he gives you a talk on internship.
Had you ever been to Mombasa before that?
I had been to Mombasa before that once because my brother, Engineer Rogo, was the chief port engineer. He's the first African port engineer in Mombasa. So during my elective year, fourth year, at the end of fourth year, I went to stay with him and did my electives in Mombasa. Yes. So I had been to Mombasa before he was there. So when you arrived, you had been told that the moment you arrive in Mombasa, they'll take care of you. There'll be an intern's mess where you'll stay and you start working. So when we arrived, we found...
Sorry, was that immediately after your exams are out?
Yes.
Oh.
Yes.
Okay.
Graduation, you'd come later
to
graduate. Your exams are out, you go.
Things have changed a lot.
Yes. So you go directly. Within the week. Yeah. So we go there and we found that the interns who were ahead of us were still staying in the interns' mess because they had now been posted out to the districts. But some of them had not left because after internship, you would be posted to the district. And when you go to the district, you'll find your one doctor. So the interns are not left. So where do we stay? That was a big question. We were enthusiastic, we wanted to work. And we were told, oh, you'd have to wait for 1 month to give this. But they said, where do we stay? And the activists that we were, we said, no, we must stay somewhere. We're going to work. Because we actually started work that same day.
After the talk?
Yes, after the talk. You're posted, you're in pediatrics, you're in obs-gynae, go. These interns who are there are going to hand over to you. So there was handover by these interns because you're now the guy who's going to be carrying, they're now medical officers. They won't be called at night or anything. The question that where do you stay? So the first night, we slept around in the benches on the hospital. You remember we had our small suitcases, nowhere. The following day, we said, no, this won't work. So we went to Kulumba's office, and Dr. Kulumba told us, you know, Nairobi sends you to me. I'm not ready. Mine is to give you work. If you have a problem, go to the provincial medical officer of health in the city. That was a Goan called Dr. Fernandez. So we all go together as a team and we go to Dr. Fernandez and we introduce ourselves and said, yes, I know you people are here. They say we are here, we have started working and we need accommodation. They said, don't you have anything in the hospital? We tell them we don't have anything. They said, okay, go back to work. We'll see what to do. We went back to work. Nothing happened. We marched there the following day and we said, we are not coming out of this office. Just give us accommodation. Luckily, that same morning, the DMS, Director of Medical Services, that's a post that they now call DG, was in town. Kenyatta used to do several months in Mombasa, during Mombasa show and so on. August, September, Kenyatta, the president, would be there, and most of his cabinet would be that side. Then December onwards, he would be in Nakuru. So most of the cabinet would be around Nakuru, and then in between it would be Nairobi. Now, this Director of Medical Services happened to be the only Kenyan who has ever held the following post: DMS, PS, physician-in-chief, and physician to the president. One person. And his name was Dr. Eric Mngola from Taita. And Mngola used to teach us as one of the honorary lecturers, because at that time, all the senior government people would also teach you. So he knew us very, very well. We were doing ward rounds with him, clinics and so on. So when he came and found us in Fernandez's office, he said, "Hey, my boys," that's what he used to call that. "What are you people doing here?" So he told him, "We came here to get accommodation." So, "Accommodation for what?" "That we have all been posted here." "Oh, so you are in Coast General. You know this is my province.
Yeah.
So I want you people to be excellent doctors." So he called Fernandez and told Fernandez, "Why are the boys here and the girls? Why are they not in the..." I said, "Sir, they're still looking for accommodation." He said, "No accommodation?" "Yes." "Why?" We explained to him. He asked them, "Give them imprest." Each one of them. And to cover their nights until you get houses. And the boys, the imprest is given to you. Make sure that you bring the receipts of wherever you live until that thing is done. 2, even if you have no house, but every night you go to the nightclub, bring the nightclub receipts to show that where you go to. So in the meantime, I will arrange for you to get a hotel somewhere where you can all stay together. Now, before I forget, it took about 2 weeks for that to happen. So my brother, who had a house in Kizingo, told me that if your friends have nowhere to, you people come. So all the boys, my brother gave us one room. So people who are on call would go to hospital. The ones when he knew would sleep in this room. So actually we stayed for 10 days in my brother's house. Yeah. The girls stayed with the mother of Mary Mjomba, who was one of our classmates, Dr. Mjomba, who was Maendeleo ya Wanawake official. So we lodged in those 2 places. Then Mngola came and got us Tudor guest house. And he also ordered that we be given a van that would ferry us from, because the interns' mess was in the hospital. So it would ferry you all the time. So we did 1.5 months with imprest and with a van taking us to hospital every day. We were proud workers, never missed a ward round, never delayed anything. We were disciplined.
So without Mongola's intervention, what would have happened?
I think that our standoff would have taken longer.
Okay.
Yeah.
You were determined.
Oh, yeah. No, get this from me. If I fix my lens on that thing, I'll reach there. Yeah. So we said we were going to, but we were not abandoning work. We were going to work. You're on call. You are everything as an intern. We said that you have to give us. There's interns mess. We want to go in there. We went there and found one of a Ugandan consultant gynecologist who was also staying there.
Oh.
Yeah, because at that time, during years in medicine, that's when Idi Amin thing disrupted Makerere.
Yeah.
So we had a lot of teachers who came in and a lot of specialists Ugandans who came in. That's an important part of our education, that Idi Amin thing. The loss that Idi Amin created in Uganda was a gain for us here because we got some of the best teachers.
Some of them were our lecturers many years later.
Many years
like
later.
20 years 30 years later, actually.
Yes. So we got the cream from Makerere coming in, and some of them were the teachers of the people who are already teaching us there, because all of our teachers were people who are ex-Makerere, people like Wasuna, Mati, and so on. They're all ex-Makerere. So their teachers were coming on this side. Yeah.
Okay. So is there anything from your internship that inspired you to do obstetrics and gynecology?
Yes, I'd always struggled to find out which was my best side. Was I more of a surgeon than a physician? And I was split between that. The one thing that I knew I didn't want to be was a pediatrician.
Why not?
For some reason, I didn't like the way kids cry, even when you're trying to do your best for them. And then my friend, Professor Bill Wasuna, was into pediatrics right from the beginning. We were very good friends. I'm even his best man. So this struggle brought me to the realization that if you want to be both a physician and a surgeon, go to obs gyne, because you'll be doing surgery, but at the same time you're doing a lot of physical medicine. That was one. Number two, during our medical school years, the infamous abortion ward in Kenyatta, there was a ward that was just for septic incomplete abortion. And the suffering that we were seeing there in young women and girls coming in with that, and then you go to theater, you find the uterus is rotten. I said, this thing, something can be done about this. And then during internship, maternal mortality. I loved saving lives, and I've never seen a place where the lives that you save becomes more immediate than in that, whether it is for the newborn or it is for the mother. She's coming in, bleeding, collapsed, you resuscitate, you remove the placenta. Sometimes it's just a placenta that is retained, and life just comes back to this person. And then there's this baby whom you struggle, called prolapse, you go do cesarean section, the baby can't breathe, and that's it. So the rewards were very immediate and very real. And then they live to thank you. The thank you from a mother whom you've saved and the baby that's there. Those things just overwhelmed me. And I said that this is why I went into medicine. This is where I went. So reproductive health then became my mantra. That's it. And I've never regretted.
I think that later on, when introducing MVA, you faced a lot of difficulties. Where was that? Because it's potentially life-saving, especially with clinical officers and nurses, if they can, do the manual vacuum aspiration.
Thank you for reminding me of that. That was a battle royal. The thing is that we had this situation. Now I'm coming back to do obs gyne, and I finish, and I'm a lecturer. And you have the whole of what we call Ward 6. As a student...
That's in Kenyatta?
In Kenyatta. I did the biggest number of uterine evacuations in one day. 75.
Wow.
Yes, 75. Because the ward is full and it's being filled every time from casualty. And you have to be in theater, and these women are brought in bleeding, and you do that and out. I did 75 between 8 a.m. and 8 p.m. And I told myself that this is not right. It can't be. The traffic, the nurses who move these people in and out, they're recovering from anesthesia. I said, never. So when I became a lecturer with the knowledge about MVA, that's what made me do that. You could actually shorten this journey from ward to theater. You didn't have to have MDs, doctors doing it. It could be done by a nurse in a health center. So decentralize these things so that these people get care faster and closer to home. So I demonstrated this at Kenyatta. And we cleaned Ward 6, which was known for crowding. You had over 100 patients in that ward.
Wow.
Smell, all these sepsis and everything. And it was a place where you only posted doctors and nurses whom you were punishing. So I took that ward and said, I will clean this place. We'll have tea in this ward. Nobody could ever thought of having tea in Ward 6 because of the smell. We'll clean it. There will be no smell. And I did that in 1 month. And changed that with MVA, training people on manual vacuum aspiration. We did a side room where we could do the evacuation. They didn't have to go to theater. We did it without anesthesia because with the MVA, the cervix is already open. You simply suck, you don't scratch. So it can be done and the woman walks home. But that success, with all the other things that, because we tied that then to post-abortion family planning and pre-abortion counseling and adolescent health, because a lot of these people are adolescents. And that is where the problem was, that at that time, Kenya was not ready to talk about adolescent reproductive health. Number two, the Catholic Church. So I came face to face with that when my daughter, my last daughter, Paula, was attending kindergarten at Consolata Nursery School. And they expelled her from school at kindergarten because of what I was doing in Ward 6. Yes. Okay. So my wife went to pick her up in the afternoon, and the Mother Superior called her and told her, Mrs. Rogo, don't bring your daughter back to school tomorrow because your husband is doing bad things for this country. So when I reached home, I found my wife there asking me, what have you been doing? What have you done? That your
to
daughter has
expel
been
a kindergarten child.
Kindergarten child. Expelled. What could I have done? So she was keen that I don't take her back. I said, I'm taking Paula back to that school. I said, they'll mistreat her. I said, no. So in the morning, I drove to Consolata. But the superior was there drinking. I didn't even talk to her. Took the kid in. Coming out, she told me I shouldn't be bringing that kid back because she's expelled. I said, how do you expel a kindergarten kid? So I told her that it's okay. I brought her back, I'll pick her up again. So from there, I passed through, I went to university because I was going for my ward round. When I reached the parking there, I'm told that the dean, Professor Buibo, wants to see you. So I go to the dean's office, and Professor Buibo shows me a letter. And the letter is from Cardinal Otunga from the Catholic Church, asking the university to dismiss me, that I was not fit to teach people because I'll teach them bad things. So my kids have been expelled on that side, and this side, they want me. So Professor Bibo tells me, Kama, what are you up to? I said, that you all know, you've thanked me for what I've done in Ward 6. He says, if that's all you've done, continue teaching. We're not doing anything. So rather than go to the ward round, I went to see my lawyer, Oraro and Rechier, to report that my kid had been expelled from school and I will sue the Catholic Church, and that if I'm dismissed, I'll also sue them. Luckily, none of those things happened, and the kid was readmitted. And I think that she still holds a record as the youngest expellee. She didn't know that until a few years back when I was receiving some award. I think the lifetime achievement in health. And I went there and somebody told that story. And she was accompanying me there. So she said, me that you didn't tell me that I was expelled. It's not on my records. I said, well, you were expelled. So my activism in that area brought me into a lot of problems with the church, particularly,
Yeah.
with some political forces that were following the church teachings and so on. But it was fun. It was fun.
So looking back many years later, because some of us, my internship was in 2012. Those are more than 20 years since introduction of MVA, and it was part of the practice.
Yes.
So looking back to that and what you're able to introduce, how do you feel about it?
It's one of my greatest achievements, and I thank God for that, because I introduced MVA in the whole of Africa. And I became the vice president of IPAS globally, because this thing was a life-saving thing for everybody. It changed the way we manage abortion
Yes.
and removed that.
Yeah.
Same thing in Mama Yemo Hospital in Kinshasa. Those dirty smelling ward. Same thing in Makerere. Same thing in Muhimbili. Black Lion Hospital in Addis Ababa. Same thing. We transformed those things. In Accra, in all the big hospitals in Nigeria. Yes. Same experience. It was, I believe, a mission of passion, but with a focus that this is not the way to do this. Technology is there, and this technology can make women's life better and safer.
And
So one of the lessons that I had there, embrace technology. And it doesn't have to be the high things that are taking to the sky. Just this syringe, it's just a syringe. Yeah. And that's it. Moving that thing, first of all, putting it in the hands of the doctor, and then putting in the hand of the nurses. That one has to be a career change for them.
Oh, yeah.
So task shifting was also, I think that's one of the first major task shifting activities that I undertook. The second one was in family planning. Do you know that IUCD, the intrauterine device, and Depo-Provera, nurses were not allowed to do it. It was only the doctor who could do it. And we demonstrated, and we even did papers to show that this thing is as safe, if not safer. IUCD can be put in by the nurse. Depo-Provera, yes, the nurse can inject. And later on, the implant too.
Yes.
Yeah. So we had to move it to, first of all, convince the OBGYN society. Because, the societies protect their turf.
Yeah. Yeah.
So I had to make presentation to COGS for this thing to be allowed, then demonstrate that it is safe, and it is now common practice.
Yeah.
I asked Professor Rogo how he shifted from basic obstetrics and gynecology to specializing in gynecological cancers, that is, women's cancers.
Together with the reproductive health issues that we are dealing with in Ward 6, the other big challenge that we had was the management of cervical cancer. Because again, cervical cancer was presenting the same way. They come in late, they're bleeding, they're infected. And in the ward round, we would go there and we say, that's cervical cancer. What do? Call the oncologist, Dr. Onyango, in radiotherapy. That was all. Call him. We go and do the staging. It is stage 3, stage 4. There's nothing we can do. Call him. So Dr. Onyango needed help because, yes, he's a radiotherapist, but he cannot do everything. And there was no gynecologist who was willing to go and work with him so that you put your minds together. During residency, however, we were supposed to do a few weeks rotating in there. And then that was just the experience, and that's it. So I volunteered to work with Dr. Nyango so that if there was any cancer in women, we would do the clinic together. So we started doing a joint clinic between the radiotherapists and gynecologists. And came in the issue now of we are now moving from just radiotherapy, teletherapy to brachytherapy, where you put the cesium inside the cervix. And that one radiotherapists can't do. So the first training that I had was on brachytherapy. And under the International Atomic Energy Agency, I went to Kaloleni University in Cairo for 6 months to specialize in brachytherapy. And we are now moving from brachytherapy, where you have a big machine, to actual using cesium and putting them and removing them. It was manual, not the machine thing that they have nowadays. So I went and trained on that. IEA gave us cesium release, and I came here. And I did think for nearly 5 years I was doing that thing on my own with them. So brachytherapy, then after that you do the teletherapy. So out of that came the question that, look, this whole area of cancer requires specialization. You cannot just be that and that. And I requested that I'm ready to go and train as an oncologist. The best oncology training at that time was at the Karolinska Institute in Sweden. So I went to Afia House to ask for scholarship to support. There wasn't any. But there was GTZ, technical person, whom I was supporting in terms of their programs with the Ministry of Health. And I'd done so much work with them. I even wrote some books and manuals with them. That when they heard that I wanted to go for this, they offered that, look, we know you're coming back. This is part of our support here. We'll give you a scholarship. Go to Sweden. So I went to Sweden to do full specialization in gynae oncology. At the end of the first year, things had changed in Afia House. And they decided that they didn't need oncologists. So my scholarship was stopped.
How did they not need oncologists?
Yeah, that was a decision made. I got a letter.
Okay.
Yes, that you'll not. They wrote to GTZ to stop it, and GTZ wrote to me that we are only going to give you, because of a sudden, we are going to extend it by 3 months. But your government has said that we shouldn't give you that. So I showed that to my bosses in Sweden. I was already very popular because I knew my work. They were not as good in surgery the way I was. So my boss actually, by the end of 1 year, used to leave me to do all the deep surgery with everybody else, because said, my goodness. So when I told them that my scholarship is stopping, I was there already with my family.
Wow.
They told me, they're stopping, yes. And why don't we employ you? No problem. So they actually gave me a full job. So the next 4 years, not only did I finish the fellowship in oncology, but I also did my PhD. And was examined there and not. And then they offered me a job that now your country doesn't want you. Stay here with us. Yeah.
But I'm perplexed by the decision that the country doesn't need oncologists.
Yes.
And cancer was showing up late,
Yes.
it still does.
Yes.
Like, what kind of policy or who makes this kind of decisions?
It's a question I'm still asking myself, but I think it's a question that everybody in Africa asks. Who makes these decisions?
Yeah.
These stupid decisions.
Yeah.
Who do they consult? Is it just a power game that somebody comes there and hits that? I can understand where it came from, because I believe that, I've been an activist all along. And even as a postgraduate student, you haven't even touched on that when you were there, because you don't know the number of strikes that you went through. So probably somebody thought that this guy is a troublesome guy. So punish him. Yeah.
But such decisions then would fuel the brain drain, because
It does.
hadn't you wanted to come back, you
It
wouldn't have come
does,
back.
because you can't believe it. When I decided to come back, my professor escorted me to the airport crying, crying. Stay here, I want you to take my position. They talked to my wife and said, here, school, everything. Yeah, stay here. And I said, no. I'd said that I would come and train and go and make a difference. So I came back, rejoined the university again, and the rest of it is history. Remember, I was coming back. The gynae oncologist who was there was Professor Juang.
Yes.
But Professor Juang did not have the depth of training that I did. He went there for attachment and came back. So I was really the first gynae oncologist in East Africa. So I come back and to this country that had denied me the opportunity, and life continues.
Did you have a job coming back, or you?
Yeah, I was in university.
Okay.
Yes.
Okay.
Yeah.
Okay.
So
you
when
came
I
back
went, I was a university lecturer. Yes.
So coming back, you.
So coming back, yes, I just rejoined the university. Yes.
Okay.
Yeah.
But we have made progress though in gynecology, because now Kenyatta and Nairobi are offering the fellowships.
Yes. Yes, we've made progress in the whole area of oncology, that we now have local training and all that. Yeah, and it's a move in the right direction. That is why people like us went out. Because the history of medicine in Kenya is that people train outside, they come back, they train others. Right now, there is 1,000 medical officers in Kenyatta.
1,000.
Yes.
Wow.
Who come from the counties, are sequestered in Kenyatta. The counties are paying for 1,000 doctors to be in Kenyatta for an unknown period of time. So you go to Mandera and you find that Mandera has 35 doctors in training here. And in the county, there's less than 10.
They have more outside than the people they are supposed to serve.
Yes. So you look at their wage bill and you see that their wage bill is big for here, and they don't have space.